Vice President Kamala Harris is leading the White House's first Maternal Day of Action. Harris spoke at a summit Tuesday about the importance of improving maternal health in the U.S.
This challenge is urgent, and it is important, and it will take all of us. And to put it simply, here's how I feel about this. In the United States of America, in the 21st century, being pregnant and giving birth should not carry such great risk.
According to research, the U.S. has the highest maternal death rate out of all developed countries. On Tuesday, the vice president urged the Senate to pass the climate and social spending bill, which includes funds to address the issue. For more, I want to bring in Rohini Kosoglu. She's an advisor to Vice President Kamala Harris. Rohini, welcome. Thanks very much for joining us. How does the White House believe the pandemic has impacted maternal health?
Thanks for having me, Elaine. Well, today was a historic day at the White House. It was our first ever Maternal Health Day of Action. The Vice President convened cabinet secretaries, members of Congress, advocates from around the country to talk about the importance of what we need to do to ramp up efforts to solve the maternal health crisis in this country. As we discussed and you noted, the United States has some of the worst outcomes of developed nations in this area. Within those numbers of women dying during childbirth, Black women and Native American women are dying at a disproportional rate. And so we must do everything we can. As the Vice President said today, this is a serious crisis that deserves immediate action. And so what was important today was that we talked about the passage of the Build Back Better Act, which would invest $3 billion into making sure that women are covered under the Medicaid program, that they are covered for up to a year postpartum. That means we're talking about postpartum checkups, we're talking about vaccinations, and we're talking about pelvic exams. We're talking about also the importance around making sure that today, as we announced, the Department of Health and Human Services is going to initiate a program to make sure hospitals are covering designations for maternal health quality standards. So these are just a number of things. And as we've heard from women around the country today, one of the common themes that they talked about was that they weren't heard during their pregnancy. And so this is an important issue that, again, we need to do everything we can to take steps moving this problem forward.
And what's behind the push for states to specifically expand postpartum coverage?
Well, right now, states have the option to do postpartum coverage, which really just means that after you give birth, that you can have these services covered, things like postpartum checkups. What we need states to do around the country is to make sure that women have those services covered. And so what Build Back Better would do is require states to do those programs and give them the funding to do those programs. And so that's why we're fighting so hard today, and the Vice President issued a call to action on this.
What steps will the White House take to improve maternal health if the social and climate spending bill does not pass?
Well, we are optimistic that the Build Back Better Act will pass. We are working hand in glove with Congress to get this done and across the finish line. Just to take a step back, we know from traveling around the country that this is a bill that will lower costs for working families. That means lowering costs for childcare. That means lowering costs for prescription drugs. That means lowering costs for preschool. And as we've traveled throughout the country, there's a lot of support out there to get this done. And we are taking that energy with the White House to Congress to get this across the finish line.
Before we let you go, I do have to ask about some recent departures from the Vice President's office. Certainly transitions in government are not unusual, and neither are questions surrounding those transitions. There has been, as you know, a great deal of scrutiny over some of these recent departures and what comes next. Do you think that the Vice President has gotten a fair shake on that?
What I can say is that the Vice President shows up every day to work on behalf of the American people, and so do her staff. We are privileged and honored to be working in this building and working on behalf of the American people. Thank you.
I wonder, I just ask because you know, there have been many questions raised, and there has been, as you know, a great deal of scrutiny over the vice president's management and leadership style within the office. Are those kind of questions helpful?
Well, I think in any environment where you're working on behalf of the American people, these are both the president and the vice president campaigned on getting things done for the American people. And what's important is that we have a staff in the building, both the president and the vice president, that is fully committed to that goal, and making sure that we wake up every day thinking about how to get this done as soon as possible.
Rohini Kosoglu, thanks very much, Rohini, for your time. We appreciate it.
Thank you.